Colon cancer, often referred to as the silent assassin, can manifest without any noticeable indications until the tumor has grown significantly, leading to complications. The United States witnesses over 100,000 fresh instances of colon cancer annually, making it the third most prevalent form of cancer among both males and females. Shockingly, this malignant condition claims nearly 50,000 lives each year. Colon cancer originates from abnormal and uncontrolled cell growth in the large intestine. Although there is no definitive way to predict its development, several preliminary symptoms may indicate an underlying issue. This video sheds light on these signs, some of which may be subtle, while others are more apparent. Prior to delving into the details, it is essential to emphasize that all the information shared here is impartial, rigorously fact-checked, and endorsed by qualified healthcare experts. Now let's explore the 9 initial indications of colon cancer. 1. Alterations in bowel patterns. The primary indicator to be mindful of is changes in bowel patterns. Typically, individuals are more susceptible to colon cancer around the age of 60. While the majority of colon cancer diagnoses involve individuals aged 65 and above, younger individuals can also be affected. Observing alterations in bowel habits is often the initial warning sign of colon cancer. A healthy colon generally facilitates regular bowel movements, occurring daily or every other day, with soft brown stools that pass easily and without any blood. If you perceive any deviations in your bathroom frequency or experience difficulties passing hard stools, it is advisable to pay attention to these concerns. 2. Diarrhea. Diarrhea, characterized by loose bowel movements, constitutes a common issue encountered by individuals with colon cancer. Technically, diarrhea is defined as the occurrence of 3 or more unformed stools within a 24-hour period. However, it is important to note that diarrhea can also arise from other conditions such as irritable bowel syndrome, lactose intolerance, and inflammatory bowel disease. According to the National Cancer Institute, some individuals may experience diarrhea due to bacterial or parasitic infections in their colons. 3. Difficulty with bowel movements. The third indication to consider is difficulty with bowel movements, commonly known as constipation. It is widely recognized that the colon plays a crucial role in waste elimination, as well as the absorption of water and nutrients from the food we consume. However, there are instances when the colon becomes congested and fails to function optimally. This results in constipation, which can be both uncomfortable and embarrassing. Initially, constipation may not appear to be a significant concern, but it can serve as an early warning sign of colon cancer. Remarkably, according to a study, over 80% of patients diagnosed with colon cancer had experienced constipation prior to their diagnosis. Various factors can contribute to constipation, including medication side effects and a sedentary lifestyle. Sometimes distinguishing between regular constipation and a more serious condition like colon cancer can be challenging. If you encounter constipation that persists for more than 3 days, it is advisable to consult your doctor, particularly if accompanied by other symptoms such as bloody stools and abdominal pain. 4. Presence of blood in the stool. The fourth indication to be attentive to is the presence of blood in the stool. Early detection significantly increases the treatability of colon cancer, with a 5-year survival rate of 95%. Unfortunately, 1 out of every 20 Americans will develop colon cancer in their lifetime. Identifying blood in the stool can serve as an early warning sign of colon cancer. The colon, responsible for storing stool before elimination, can exhibit bloody stools due to various types of cancer and other conditions, such as ulcerative colitis, diverticulitis, and hemorrhoids. Typically, blood in the stool results from inflammation or injury in the large intestine and can also stem from bleeding in other parts of the digestive tract, such as stomach ulcers. Additionally, certain medications like ciprofloxacin, anti-diarrheal drugs like lactulose, or iron supplements can cause bloody stools. 5. Rectal bleeding. The fifth indication to take note of is rectal bleeding, which can potentially be a sign of colon cancer. The rectum, the final section of the large intestine spanning approximately 5 inches, serves as the exit point for waste from the body. However, it's important to recognize that rectal bleeding is relatively common, and most individuals experiencing this symptom do not have colon cancer. Other conditions, such as hemorrhoids and anal fissures, are known to cause bleeding in this area. Additionally, rectal bleeding may be attributed to the presence of a polyp or other growth on the surface of the colon. 6. Unexplained abdominal bloating or pain. The sixth warning sign is unexplained bloating or abdominal pain. The development of colon cancer can be influenced by a combination of genetic factors and lifestyle choices, including diet and exercise habits, which can elevate the risk by up to 30%. Genetic factors contribute to 10 to 15% of all colon cancer cases, while other factors such as a poor diet, obesity, smoking, and alcohol use account for a 5–10% increase in risk. Bloating is a prevalent symptom associated with colon cancer. It can manifest in the early stages of the disease or may be indicative of other non-cancerous conditions. Bloating refers to a sensation of fullness or swelling in the abdomen, often caused by gas or certain foods and medications. If you experience abdominal bloating after meals, consider consuming smaller, more frequent meals throughout the day instead of 3 large meals. This can help prevent bloating caused by overeating and assist in maintaining stable blood sugar levels. 7. Persistent feeling of fullness. Maintaining a healthy diet can certainly contribute to reducing the risk of colon cancer, but it may not be sufficient for prevention. Exercise also plays a vital role. If you constantly feel full, even without consuming food, it could indicate an issue with your digestive system. Colon cancer has the potential to cause bloating, constipation, diarrhea, and other digestive problems that disrupt normal eating patterns. Initially, these symptoms may be mild and easily overlooked or dismissed compared to other more noticeable signs of colon cancer. In fact, if you experience additional symptoms like weight loss or fatigue, you might attribute them to unrelated issues, delaying seeking appropriate medical attention. Regardless of age, whether you are 61 or 16, the best approach for preventing colon cancer is to adopt a healthy diet, engage in regular exercise, and maintain a healthy weight. By doing so, you promote a clean and well-functioning colon. If you have a first-degree relative, such as a parent, child, or sibling, who has been diagnosed with colorectal cancer before the age of 55, your risk of developing the disease is higher than average during your lifetime. Furthermore, if 2 first-degree relatives have had colorectal cancer before age 55, your risk is even greater. African Americans face a higher risk of developing colon cancer compared to other racial and ethnic groups in the United States, although this disparity may be influenced by factors such as unequal access to screening tests rather than solely biological reasons. Remember, if you experience any of the symptoms mentioned above, do not delay in contacting your doctor. It is important to note that these symptoms may indicate early signs of colon cancer rather than definitive indicators. If you have any of the discussed risk factors for colon cancer, be sure to discuss with your doctor whether colonoscopies would be the most appropriate screening option. If you found this video informative, please show your support by liking and subscribing to our channel